Knock knock. I'm just going to close the door for privacy. So, hi, my name's Eric, and I'm going to be your nurse who's going to do your full head-to-toe exam with you today. So, before we start, can I have your name and date of birth?
Rosanna C. 12/6/61.
Good. And how are you feeling today? Are you in any pain whatsoever?
Just a little bit hip pain.
A little bit of hip pain? We can definitely take a look at that when we do your musculoskeletal assessment. So before I start, I'm just going to do some hand hygiene. And first, I'll start by a general appearance. So the patient is mostly clean and well kept with no kinds of unusual odors. And I'm just going to start with your head assessment. So I'm inspecting the scalp and I don't see any kinds of masses or abnormalities on the scalp, and I don't see any redness or any kinds of hair falling or alopecia, and the scalp looks by and large pretty symmetrical. So now I'm just going to palpate your scalp, feeling for any kind of masses, lesions, or any kind of irregularities. Does any of that hurt? Just let me know, okay?
Okay.
So I don't feel anything, none of that hurt?
No.
Good. So the scalp is symmetrical, even, and there are no masses or lesions present. And when I palpated, the scalp was also symmetrical in shape and mostly round with no masses, lesions, or tenderness present. So, now I'm just going to take a look at your eyes. Alright, I'm just going to shine this light at your eye a couple of times.
Okay.
Direct and consensual pupillary responses are present and intact, and the pupils were reactive to light. Next, I'm going to have you look far away at the tip of this and follow it with your eyes. Perfect. Eyes are able to accommodate and converge appropriately on the patient. And now I'm just going to put my otoscope together and I'm going to just take a quick look at your eyes. So I'm just going to shine this in between both eyes at first. I see two objects that are in the same spot, so the corneal reflex is grossly intact. And I see the red reflex in both sides of the patient, so the red reflex is also intact. So now I'm just going to have you look at the tip of this, and I want you to follow it with your eyes, okay?
Okay.
The patient is able to follow all 6 cardinal fields of gaze. So cranial nerve 3, 4, and 6 are grossly intact. So now I'm just going to take a quick look at your ears. Just taking a look in your ear canals. Alright. I don't see much cerumen, and I don't see any discharge, swelling, and your ear canals are pink. And also your tympanic membrane was silvery gray, which is what we're looking for. Same with this ear. I don't see any kind of excess cerumen, discharge, swelling, and your ear canal also looks pink, and your eardrum is a pearly silver, and we like that, and that is a normal finding. Alright, and now I'm just gonna whisper a couple of words in your ear, and I want you to repeat what I said.
Okay. Car,
House.
house,
Patient passed the whisper test and is normal, so cranial nerve 8 is grossly intact, as that is the vestibular cochlear nerve. So now I'm just going to take a quick look at your nose. So your nose looks symmetrical, and I don't see any kind of masses, lesions. And I'm just going to palpate, let me know if any of this hurts. Does that hurt?
no,
And I'm going to palpate your sinuses, maxillary sinuses. Does that hurt?
no,
How about your frontal sinuses?
no,
All right. No tenderness, swelling noted on the this frontal and maxillary sinuses. So can you just turn your head towards the ceiling, to face the ceiling? I'm just going to take a look at your nasal membranes inside your nose. Nasal membranes are pink. And I don't see any kind of discharge. And it looks painted through it, but just to be sure, can you just cover one nostril and blow out each? Good. Now the other one. All right. The patency of the nostrils of my patient are patent. So now I'm just gonna put my gloves on and take a look at your mouth. Actually, before I do your mouth, I'm just going to quickly back up to your eye and take a look at your sclera. Alright. Conjunctiva is pink and sclera is white, and no damage noted on the cornea. Now can you open your mouth? Lips are dry and intact. Gums are pink. Mucosal membrane is moist and intact. The tongue is also dry, moist with no growths. And can you open your mouth again? And both your hard and soft palate are completely intact, and there are no growths or irregularities there. Now can you just stick out your tongue and say ah?
ah,
Perfect. Cranial nerve 9, 10, and 12 are grossly intact, as there was bilaterally symmetric uveal opening on both sides of the mouth with that test. Now I'm just going to take, and the tonsils were non-visualizable, and therefore can't be swollen. Now I'm just going to take a quick listen to your lungs. So I'm going to listen to your lungs in real life for 20 to 30 seconds, but I'm just going to speed it up and do it for just one breath cycle. Deep breath in and out. Deep breath in and out. Deep breath in and out. good. Good. Lungs are bilaterally clear, and I don't hear any kind of adventitious lung sounds that are present. Now I'm just gonna palpate your thorax for any kind of masses or abnormalities. I don't feel any kind of masses or abnormalities. And you just take a breath in and out. And we have bilaterally symmetric breath extension, which is normal. So now, and also there's no extra effort which has to be placed in order to, there's no extra inspiratory or expiratory effort which is noted, and there's no apparent signs of distress such as nasal flaring or using accessory breath muscles. So now I'm just gonna percuss your back to listen for any kind of both your organs and to percuss for any kind of masses. Alright, tympany is noted near the lower back, and resonance, not hyperresonance, is noted in the thorax, which are both normal findings in percussion of the back. Now I'm just going to do a quick cardiac assessment, moving on, and I'm just going to put my hand on your preacordium to feel for any lifts, heaves, or thrills. And I don't feel any sort of that, just a regular heartbeat, which is good. And now I'm going to listen to your heart sounds also for 20 to 30 seconds in real life in order to auscultate S1 or S1 and S2. S1, S2 at the aortic, S1, S2 at the pulmonic, S1, S2 at the tricuspid, S1, S2 at the apical mitral valve. Now I'm going to do the same with the bell. S1, S2, S1, S2 at the pulmonic, that was the aortic, S1, S2 at the tricuspid, and S1, S2 at the mitral valve. I don't hear any kinds of murmurs or gallops. Let's see, and now I'm going to go on and just palpate your extremities. So I don't feel any kind of edema on either your arm or your feet. I'm just going to feel your wrist. 3+ pulses at the radial and 3+ pulses at the pedal site. And I'm just going to take a look at your skin. I'm going to pinch you a little. And on the pinch test, there was rapid rebound, so the patient's skin is elastic, soft, a little bit cool, but nothing out of the ordinary. And I didn't notice any kinds of scars, moles, or otherwise lesions on the patient's skin. So I can't do an examination of the lesion. But if there were any lesions, I would use my gloves to look at the texture, temperature, and turgor of said skin, which I feel with the back of my hands. So now I'm going to ask you to lay down, and I'm just going to quickly do your abdominal assessment. Alright, so first I'm just going to listen to your abdomen 3 times in each quadrant, and what we're hoping to see is bowel sounds each quadrant. I'm going to listen for 20 to 30 seconds each. Bowel sounds present in the lower right. Vowel sounds present in the upper right. Vowel sounds present in the upper left. And vowel sounds are present in the right. I mean the lower left. Now I'm just going to percuss your abdomen and to listen for also your organs, and to percuss for any kind of masses 3 times each quadrant. Alright. No excessive tympany or any kind of hyperresonance is noted in the abdomen, and now I'm just going to palpate and let me know if you feel any kind of pain or tenderness.
Okay.
Alright, no tenderness or masses noticed on examination and palpation. So that is your abdominal exam. So now we can move on to your musculoskeletal exam.
Okay.
So now I'm just going to do a quick inspection, and throughout the exam when I was doing your skin, I didn't notice any kind of redness or swelling on all the joints. So now I'm just going to move on to palpation, and I'm just going to feel for any kind of dysymmetry or any kind of inflammation. And while I'm here, I'm just going to palpate your lymph nodes too. So that's your preauricular, posterior auricular, submental, submandibular, and your occipital, your superficial cervical, your deep cervical, and your posterior cervical, and your supraclavicular. I don't feel any kind of inflammation or masses at your neck or your lymph nodes. So now I'm just going to quickly palpate your trachea, and the trachea is midline with no masses present. And I'm just going to go behind you. And can I have you swallow? Alright. Thyroid is palpable and rubbery to the touch. And I didn't notice any masses, lesions, or tenderness at your neck. And now I'm going to move on to your shoulders. No kind of masses there or tenderness. No masses or lesions or tenderness at the elbows. No masses or tenderness at the hips. No masses, lesions, or tenderness at both hands. No masses, lesions, or tenderness at the knees. And none masses, tenderness, or inflammation at the ankles. So now that I did that and palpated, I'm just going to need to have you do some active range of motion. So can you just shrug your shoulders and move them around? Perfect. And can you just do a quick circle? Both. Perfect. A little bit less range of motion in your left arm. Alright, so now can I just have you flex and extend your elbows and arms? And same with your knees. Alright, perfect. So now I'm just going to ask you to stand up, and we're going to do a quick range of motion of your hips. So for safety, I'm going to hold on to you to give you some balance. And can you just kick forward with your left? Now back. Both. There you go. Oh. There you go. Now kick out.
Out this way?
No, towards me.
The
No.
side?
Now in.
In.
Good. Now kick out that way. With your other leg. Perfect. Full active range of motion. So now that we're up, we can go back to your hip. We can stay at your hips, and we can do that again, but with... Hold on to that for stability. So now I'm just going to push against you. So you kick forward. Now kick in. Perfect. Now kick inside that way. Perfect. Now kick out. 5 out of 5 strength on left lower leg. Now kick out, forward, backward. Now out to your right. Now to your left. Full strength on the lower leg, the lower hip. 5 out of 5 strength. Now can you just sit down? Now you can have a seat again.
I feel a little pain here.
Alright. I'll definitely take that in the chart and take notice.
Okay.
So, on a scale of 1 through 10, how would you rate your pain?
It's 2.
A
It
2?
hurt more when I do circle.
Okay, so it hurts with moving back. Okay. I'll definitely put that in the chart. So now you can have a seat. And I'm just going to have you kick out towards me. Now pull in. Kick out. Now in. Perfect. Knees are 5 out of 5 strength. And I'm going to have you do the same thing with your elbows. So bend it in. Now push out. Alright. Pull in. And extend. Good. Now with your shoulders, shrug against me. Good. And cranial nerve 11 is also grossly intact with that. So now I'm going to do your, did that. So now we're going to move on to your neuro exam.
Okay.
So I'm just going to have you first put your finger on your nose and move it to my finger. And we're going to do that a couple of times.
Oh, I forget to do that.
Nose, finger, good. And now we're going to do, can you just rapidly alternate on your knees? Flip them on your knees. Good. And now I'm just going to do your deep tendon reflexes.
Okay.
2+ on the left patella, the right patella, and 2+ on the right on the left. Bicep is deep tendon reflex is present, and left bicep reflex is also present. And now I'm just going to have you squeeze my fingers with both your hands. Good, bilaterally equal strength on both sides. And now we'll just do the rest of your cranial nerves we didn't already cover. So close your eyes and tell me what you smell.
Alcohol.
Good. Alright. And on the packaging, can you read me what this says right there?
It's the alcohol. 70% brain.
Good. So that is cranial nerve 1 and 2, which are intact. Cranial nerve 3, 4, and 6 were already done when we did the 4 fields of gaze and the pen light. And now I'm just going to do cranial nerve 5. So I want you to close your eyes, and I want you to let me know when you feel something on your face, okay?
Mm-hmm. Right there. Yes. 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 Yes.
Good. And now I'm just going to have you keep your... So cranial nerve 5 is also grossly intact. And while I have this, I just want to do a sensory test. So when I push, so this has a point on it, so when I push that on you,
Mm-hmm.
that's sharp, and when I lay it flat, that's dull, okay?
Okay.
So close your eyes. Sharp.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Alright. Exterior senses are grossly intact. Alright, so now, can I have you smile? Now frown. Alright, so since there's bilaterally symmetric facial expression, cranial nerve 7 is grossly intact, and cranial nerve 5 was intact with the stroking the face. And we already tested cranial nerve 9, 10, and 12 with the sticking out of the tongue and saying so that leaves us with cranial nerves 11 and 12. Cranial nerve 11. You shrug against me? Good. Now turn your hand against my palm, your head against my palm. Now the other way. SCM and shoulders are able to provide resistance, so cranial nerve 11 is grossly intact. Do you have any questions about today's exam?
No, thank you.
Alright, so I'm all set, and have a nice day.
You too. Thank you.